Hello and welcome class 9. Hope you all are doing good and are safe at your home. We'll again take up the same topic, people as a resource, chapter 2 of your economics. We are continuing that chapter. We have already done various aspects of improving the quality of population, how the population can be turned from liability to an asset, how the investment can be made in human being. We have done the importance of education and various provisions made by government in field of education. The next topic is health. After education, the next important aspect through which we can increase the quality of population is health of a person. It is known to everyone how much the health is important to us. We are sitting at home right now. Why? Because we are going through a phase in which we are giving utmost priority to our health. The health of a person helps him to realize his potential and the ability to fight illness. An unhealthy person becomes a liability for an organization. We know the meaning of liability. If a person is unhealthy and is not going at work, unnecessary, it will become a burden on the organization in which he is working. Health is an indispensable basis for realizing one's well-being. Indispensable means unavoidable. We cannot avoid the health aspect when we are talking about any person. So, improvement in health status of population has been the priority of the country. If you're healthy, then only you can become a resource for the country. Then only you can earn. An unhealthy person or a state of mind can become a liability for the country. Our national health policy aimed at first, improving the accessibility of healthcare. Accessibility of healthcare means within reach. The healthcare services should be within reach of everyone. There are many various backward areas and remote areas where there is shortage of healthcare services. So government should make provisions, especially in these areas. So the national policy aimed at improving the accessibility of healthcare, family welfare and nutritional services, with special focus of underprivileged segment of population. Underprivileged means poor people, those who are not having privileges. Second is, over the last 5 decades, India has built up a vast health infrastructure and manpower required at primary, secondary and tertiary care in government as well as in private sector. If we see the data of last 50 years, we come to know that India has built up a vast health infrastructure. Health infrastructure includes hospitals, chemists, clinics, and manpower required at various levels refers to the doctors, nurses, medical students, medical colleges, etc. Both government and private sector worked together in achieving this. The measures adopted by the government at various levels has resulted in following points. First, increased life expectancy. Life expectancy refers to number of years a person is expected to live in a particular country. If in our country the life expectancy is higher, then it shows that the health situation of the country, the health services of the countries are developed and are much better. Increase in longevity of life is an indicator of a good quality of life. Second is, infant mortality rate has come down. Infant mortality rate is the rate at which the children are dying before achieving their first birthday. That means if a child is born, he is not able to survive. The health services are not good and it could not help that child to survive. So if we have lower infant mortality rate in our country, it is better. So From 1951 to 2000, it has came down. So it is a positive indicator. It involves the protection of children from infection, ensuring nutrition along with mother and child care. Third is the birth rates and death rates have also dropped. The decreased birth rate depicts the higher level of education given, and the decreased death rate depicts the good health services in the country. If we look at the health infrastructure over the years, there has been increase in dispensaries and hospital, number of beds, number of doctors, number of nurses, number of public health centers in villages, which shows overall growth of the health facilities in our country. Now, when we talk about the health facilities, we come to the health education given to children in form of medical education, we say. There are many places in India which do not have even these basic facilities. Just 4 states like Karnataka, Andhra Pradesh, Tamil Nadu and Maharashtra have 81 out of 181 medical colleges. Majority of the colleges, medical colleges, are concentrated in few states. And on the other hand, there are some states like Bihar and Uttar Pradesh who have really poor health infrastructure and very few medical colleges. So you can see the difference in between the states. Some states are developed, having good health facilities, and some states are not having. Now here are 3 definitions which we have talked about just now. First is infant mortality rate is the death of a child under 1 year of age. Birth rates and death rate is the number of babies born for every 1,000 people, and death rate is the number of people per 1,000 who die during a particular period of time. So these definitions